how it's developing to become a real source of opportunity. Before going back to Chris to moderate the session, I'd like to particularly thank our partners for this event, who are OCP, Spirit Aerosystems, BNC Bank, Consumar, Aqua Group, Sothema, British International School of Casablanca, and H&A Investments. Thank you all for wishing you a successful webinar, and over to you, Chris.
Thank you, Stephen. Good morning all, and Ramadan Mubarak. Welcome to this morning's webinar on the UK-Morocco health sector trade and investment opportunities. And thank you from me to Britcham for hosting this webinar, and to all partners and for arranging the excellent panel this morning. Before we turn to the panel, as Stephen suggested, I'm going to quickly reflect on the current state of play of UK-Morocco trade and in the health sector in particular. And I think where we find ourselves right now in terms of the UK-Morocco trade relationship is at a moment of real renewed momentum. The UK-Morocco Association Agreement was signed upon the UK's exit from the EU, and the inaugural Association Council, the bilateral ministerial, was held in December of last year in London. Ministers from both governments came together to discuss the agreement and the commercial relationship in general, and to reflect on the ways that the two kingdoms may wish to strengthen that relationship and continue to develop the agreement and the sort of trade that operates underneath it. And indeed, as part of that, we will host the first trade subcommittee under the association agreement late in the next few months, and we'll have another ministerial association council in December of this year. In terms of trade between the two kingdoms, total trade in goods and services, including exports and imports, between the UK and Morocco was £1.8 billion in the 4 quarters to the end of Q3 2021, which was a 7.2% or £124 million increase over the same 4-month period a year earlier. I think we can reflect that, of course, there is some elements of COVID recovery in those figures, but on the whole, that is a very positive picture in terms of the growing opportunities across a whole range of sectors between the two kingdoms. In terms of what the UK Department for International Trade is doing in Morocco, we have overall responsibility for advancing and growing the commercial relationship between the two kingdoms. And the team here works across 2 distinct areas, trade policy and trade promotion. And linked to our Department for International Trade, we also have a UK export finance lead based in Morocco who looks specifically at the area, at the region. In terms of trade policy, as mentioned, that means we're looking specifically at the trade agreement and how we might seek to improve and evolve the agreement, and working to address specific market access barriers for companies who are looking to access the market. And that can be everything from sort of major regulatory or legal hurdles to specific problems with customs at the border that the UK government might be able to help with. On trade promotion, we're focusing on priority sectors to support imports, exports, and investment between the two kingdoms. And these sectors include energy, agriculture, financial and professional services, education, mining, textiles. But of course, today we're focusing on the health sector. Why are we looking at health? As Stephen's already mentioned, the Moroccan budget for health in 2022 is 23.5 billion dirhams. Of that, 6.9 billion dirhams have been dedicated to investment, which is a 3 billion dirham increase from last year. There's a national health program within Morocco focusing on upgrading public hospitals as a national priority, looking at public-private partnerships. There's a focus on healthcare infrastructure and scientific research, and also a focus on developing self-sufficiency and local manufacturing on drugs, vaccines, and PPE. The Ministry of Health introduced the National Healthcare Plan 2025 with a budget, again, a budget to focus on investments and reinforcement of various national health and disease control programs. And leading subsectors within this include COVID-19 test kits, ventilators and respirators, ICU equipment, MRI equipment, X-ray equipment, and cancer treatment, amongst others. For DIT Morocco, we're looking at the health sector as a real growth sector with key opportunities around pharmaceuticals, medical technology, and other key aspects. Recent developments in the sector have included the UK company and BII, formerly CDC-backed Helix Bio, announcing that they will acquire the Pharmaceutical Institute, or PHI, the Rabat-based pharmaceutical manufacturer. In terms of statistics, in 2021, UK exports to Morocco of optical, photo, technical, and medical apparatus was estimated at over US $29 million. and UK exports of pharmaceutical products to Morocco was estimated at over $22 million in 2021. We want to find the areas that the UK can grow investment and exports and support Moroccan suppliers who are also looking at the UK market. Events like this, with Richam's support, are really key to us growing that interest, and we're hoping to engage and support others in the future and hear from any businesses that have an interest in what the Moroccan market may offer. With that, I'd like to turn to our first panelist, Mr. Azzeddine Ibrahimi. Mr. Ibrahimi, perhaps I could first ask you to reflect on how would you describe Morocco's experience in managing the pandemic, from increasing hospital capacity, providing PPEs, and ensuring vaccine access?
Well, Chris, thank you very much for inviting me and being part of this webinar. I think it's the right time to do it, actually, with the Brexit and with the coming out of the COVID-19 pandemic. Hopefully soon, I think it's the right time to do that. And I like the title, actually, Opportunities, because every time we talk about the pandemic and the Brexit, we think actually it's really the worst thing that could have happened to both countries, but I don't think so. I think it's a really great opportunity for Morocco and for Great Britain to enhance actually the relationship, and the economic relationship definitely will be helping, beside, of course, the diplomatic and other fields that will be managed by other people. Actually, I think when we look back actually after 2 years of the pandemic, I think Morocco, and not because I'm Moroccan, actually, did very well. Actually, it's great, and Morocco, when we manage actually the COVID-19, and I can say that since I am in the National Committee, Scientific and Technical Committee for COVID-19, I think what was really nice about it is just we did it ourselves by our capabilities and competencies, and it was great doing it this way. Actually, the thing that I'm really proud of, I think it was a great leadership, and I think when you want to have a relationship with a country, a strong leadership is something that you need, and I think His Majesty was really in the first position during the pandemic, and I think it was a really big plus for Morocco deciding a lot of things. So when I go back and look at December 2019, nobody thought actually that we'd be having a pandemic. We thought maybe it's going to be a small epidemic, a really rising virus somewhere in China, and it will be done. But I think by February and January, everybody knew that we'll be having actually a pandemic. So Morocco, I think we were very harsh with ourselves, and through SWOT analysis, we knew, and really it's going to be tough to manage the pandemic. And I think what we did, and it was a really right way to do it, is anticipate. So actually, Morocco was one of the first countries before getting the virus to confine the population actually and to restrict movement. A lot of things were done, and I think we gained a couple of weeks over Europe and other places, and this 4 or 5 weeks helped us actually check what is happening, for example, in Great Britain, and take a lesson from it. And maybe if it was a great thing to do, we'll do it, and if it's not, we'll not be doing it. For example, I would just give an example here, since we are talking about Britain. Morocco, since the beginning, didn't believe in herd immunity, so it's something that never came as a Moroccan strategy since the beginning. And after that, we were harsh with ourselves because we knew that we didn't have enough beds for ICUs. We don't have any therapies. We don't have any vaccines. And beside that, even the mask, and I remind everybody by March, April 2020, everybody was looking for the same supplies. Mask, for example, a test, for example, lots of things. And I think one of the lessons that we should have, and we have it already, just to be independent somehow when you face a pandemic. Beside that, I think one other lesson is just if you have a local pandemic, you'll be able actually to manage it by yourself. It's something that's really something that we have to do. And Morocco didn't wait for the end of the pandemic to start that, as you said, but started that during the pandemic. So, for example, we extended the number of ICUs bed, and I think that was very good. The second thing, nobody done that in the world actually. being the healthcare system to include millions of people. I think there is an upgrading of the health system in Morocco, and I think that's a great opportunity for the British and for us. Actually, it's something that's really, because just to give a number, I think we'll be including more than 11 million people in these programs, and it's going to be private and public. So I think it's a great opportunity for everybody here. The other thing, Morocco, and you mentioned that it started all what is a biotech, and I think it was a strong leadership saying that Morocco wants to be a leader in a biotech. And here there is a great opportunity actually for British and the Moroccan companies to solidify their relationship, to make more technologies to the field. The other thing, I think, instead of Britain looking for outsourcing things, thousands of miles, I will say, to China, maybe a flight of 2 hours from London to Casablanca will be helping that. So I think lots of things will be done in that. But coming back to how we managed actually the pandemic, I think it was quite interesting because it was anticipation, participative approach, because we had to ask more Moroccans to be involved in it. And we have this huge fund that was really elaborated and to help the Moroccan economy, and it helped a lot actually the Moroccan economy. So through the waves, and I think we saw a lot of waves of the Omicron, actually one of the biggest surprises, I will say, that the Moroccan health system survived, and I think that was great because we never had in Morocco to select between patients. And I think that's a big issue, ethical issue, that we never had to do it in Morocco. And I'm very glad to what we did, because we were able actually to get all the Moroccans for free of charge. And that's something that we have to say for the treatment, for the vaccines, for the home care. And I think that's a really lot of positive things. Something that we have to work on, and I think something that the Moroccan health system will have to work on, is actually what you said exactly. It's the capacity building will be something very good to do, because I think here we are including millions of people and we need to have this kind of capacity. The second thing is research, scientific research. Everybody knew that like scientific research is really something very important for this century that will be mainly a century of pandemic and lots of viruses, and I think we will have to be really on scientific research and translational research. Helped a lot with that, and I think something very important. The third point that nobody mentioned, but I think there is great opportunity for Moroccans with British companies, is training and education. In Morocco, we need a lot of human resources. Morocco needs almost 30,000 MDs. And I think here we need to do training and education. And that's something, there is a huge opportunity here, since a lot of Moroccans, more than every year, I think we are sending more than, I will say, easily between 5,000 to 10,000 outside the country to do their training. And it will be good to do it in-house. And I think here we can have some companies coming to do it. So there is a huge opportunities here, and I think we did a lot of benchmarking at the international level, and I think Morocco is coming out of it nicely.
Thank you, Mr. Ibrahimi. Perhaps just to sort of focus on the sort of second part of your answer there, and you touched on this, but if you could elaborate on what Morocco's plans are at this stage for building a post-pandemic resilient health system.
Well, I think the idea now around the world, and to be clear about it, is just how to have a health system that is really flexible. Flexible meaning that this health system, without having new buildings, being able to face a pandemic by itself, by expanding the walls, that's what I call it, without building new things, but just by expanding the walls of what we have right now, but by having more resources, human resources, to be involved in treating the pandemic or treating the diseases following the pandemic. Without, and that's very important, without forgetting to take care of chronic diseases patients, because that's a really big thing. So the opportunity here is to have a system that can be able to face off a pandemic and epidemic situation, and on the other hand, have this routinely mission there. And I think lots of studies are coming out showing that maybe for the cancer people, for the diabetic people, weren't that really taken care correctly. And I think for the next pandemic, we shouldn't have that. We should be able to expand the wars, mobilize the human resources to have that. So, you know, that's when you say mobilizing human resources, you need to have these human resources. So in Morocco, we have to have these human resources, a qualified human resources. Why I think it's going to be good to have this training and education programs. And Morocco is going through that. So I think the ministry is increasing the cohort for the medical schools. And I think that's an opportunity again. And I don't see why we cannot have a British medical school in Morocco, to be front and upfront about it. It's something that we have to have here, since a lot of Moroccans actually are looking to the Anglo-Saxon kind of doing things, doing business, a way of doing this adventure. And I think it's a great thinking to push in this sense. And I'm sure there is lots of great schools, medical schools that will be interested in Morocco. And even from the financial point of view and business plan, there will be no problem with that, because I think it's really something that is feasible. The thing that we are doing in Morocco, and maybe we'll come back to it, is this platforms for biotech platform that we are building in Ben Slimane. And I think His Majesty and his involvement was really capital for that. And I think we are saying what we want to do. We are clearly saying that Morocco has to be a leader in biotech, at least at a regional level and in African countries. And I think that's Morocco working on its relationship with Africa will be a hub actually for a lot of companies in Britain needing to go definitely to French-speaking countries. And I think Morocco will be a good partner to do that. For example, Morocco, and lots of people are restricting the platform to producing vaccines. That's not true. This platform, and it's a really huge one. I think it's going to be one of the biggest ones in the world, because it will be 15 lines of production that will be in Ben Slimane, and that's really will help having the COVID-19 vaccines, having any kind of vaccines. And don't forget, we can have also the biosimilars and the biotech drugs. So all the anti-cancer drugs, all this protein, therapeutical proteins will be produced in Ben Slimane. And that's really great, because here we can see a partnership, because this project has 3 steps, but I will be talking about the step right now. Is if you want to produce, you have a bulk, you have your medicine or drug prepared, and you want actually to fill and finish. You are welcome in Morocco to do it, and you will have all the infrastructure to bring it to French-speaking countries in Africa. And I think that will be great. Second thing, we are trying to have the made in Morocco for the biotech drugs, and that will be done through scientific research. And there is a huge opportunities with that. Morocco also, I think it's an opportunity, is going through the genomic medicine. It's something that is happening and it's coming. Personalized medicine will be here in Morocco, and it's already here, I think. And here we're talking about a lot of technology for sequencing and genomic sequencing. And here I'm putting on the spot a lot of your colleagues, saying, for example, there is this technology, the nanopore Oxford technology, that is a really great technology for genomic sequencing. And I think I'm asking you if we can do something about that, because this technology is needed in Morocco, because Morocco will have an initiative for personalized medicine. And it will be great to have this technology in Morocco to help to have this genomic era in Morocco. So I'm just mentioning a lot of opportunities. Beside that, I think hospitals, building hospitals, having a private sector in the health sector, in the health field will be very good. And there is huge opportunities for Morocco and our British partners to actually elaborate not only strategies, but I think plans to do that.
Thank you, Mr. Ibrahimi. But perhaps if I could again just dig in slightly on one element there, which is you focused on the new vaccine production site in Ben Slimane, and I think you've mentioned a few of the new vaccine technologies we've seen emerging over the last few years, including, of course, mRNA vaccines, which have been very prominent due to COVID. In addition to sort of the elements you've mentioned, how well placed do you feel Morocco is to be part of this next generation technology around vaccines?
Well, I think it's really Morocco, there is a political will to do it. And I think it's clear, there is no discussion about that. And I think when you have a political will, that's something very important that we have it. And you mentioned the money, because when you invest almost $500 million, we have the money there. So we need the human resources. And here we need actually some benchmarking with the British companies. I think it will be good to have that. So far, we have this company that is starting to do it, and there is this Moroccan company that was actually built to do this project. But there is no way, I will think, that there is no room for other initiatives like that to help that. On the Moroccan way, actually, the technologies, all the technologies will be managed in Morocco without any problems. I think if you talk about the adenovirus technology, the AstraZeneca Oxford technology, I think it's really feasible in Morocco. We started to initiate some relationship with the Merck, for example, and I don't see why we are not doing it with other countries to bring the technology to Morocco. And I think Musliman will be having all the technology together in Morocco. So we'll have the mRNA technology, and it's a great technology that we need to have in Morocco and to build on it, the adenovirus technology also. And I think also with just a regular technology, the classical one, the inactivated virus will be here. So what Ben Slimani is doing, I think, we are gaining a couple of years by creating an ecosystem around which we can build a new technology, and not technology just for Morocco, but I think the program or the project is built in a way looking to Africa and having our head in somehow looking how to partner with our Europeans. But for me, when I'm talking about Europeans, I'm splitting them these days. I'm talking about Great Britain, but I think there is a huge opportunity to do it. And beside that, the European Union, but that with all these problems. I think that if I have to finish on that, I should say what is really the Brexit did actually is just to have country-to-country discussion. And built on that, I think we can have a lot of things done quickly, what we need actually in Morocco. And I think it could be a very nice story and success story is to this health system during the pandemic, the needs of it, the opportunities on it. And with the surgery SWOT, what we did, there is a lot of needs and lots of opportunities that we can build on them with the two countries with less restriction that we had before, or as we had with the European Unions.
Thank you very much, Mr. Ibrahimi. I think a really interesting set of reflections, looking through Morocco's trajectory through the pandemic and the many positives of that, and now the sort of key objectives for the healthcare system and sort of specific avenues that Morocco is looking in terms of that development. And I suppose most importantly for this webinar, some really clear examples there of where there may be British opportunities to be involved. And you particularly mentioned sort of education, and I know across the education sector, you mentioned the sort of pivot to English, and of course we've seen a huge growth in the use of English and English education in Morocco over the last few years, and the crossover there with the health opportunity seems something that is ripe to explore further. And you also mentioned about a number of the technologies and potential work for collaboration there. So I think some really tangible actions for us to take away. So thank you very much. Perhaps now I'll turn to Mr. Hassan Belkayat. Thank you for joining us today. And perhaps I'll ask first, between 2021 and 2022, as we've mentioned, the Moroccan government increased the budget allocated to health by 19%. What are the characteristics you see of the new health policy in Morocco?
Thank you, Chris, for inviting me to this webinar. To discuss and to speak about this quite important sector, which concentrates a lot of the population basically needs, but also it's a quite growing sector today, even on an economic point. Today, as you know, and it was said before, the heart of the national health reform is actually the generalization of the social protection, which is a very important move and a revolution in the system today. And it's not only a social protection, it's actually a national insurance program, a mandatory insurance program, and all the population will be insured. Today, only 1/3 of the population has an insurance, basically public actors and employees of the private sector, so employees of private and public. And we have also 1/3 of the population who has free access to the public sector, which is basically the poorest part of the population. And we have 1/3 of the population who has no social protection. That created basically a system with two complete different health systems in the country. The public sector, which is almost focused at 95% on the 30% who has an assistance, and the private sector, basically, which drains all the population which is insured and the non-insured actually population who pay for the services. Tomorrow it's a complete change. Everybody will be insured, including, the poorest part of the population, where basically the country will pay for the insurance. What does it mean? It means also that the whole system is going to change, and even the public sector is going now to bill for its basically services, and the whole funding of the system will go to the payer system and not through the budget of the state. So what we are facing today, we have basically in the 23 billions that you're speaking about, a large proportion goes into infrastructure, but also a large proportion goes into the operations of the public health system. Tomorrow, all these funds will go to the health payer, and that means that all the public hospitals, which concentrates maybe 50 or 60% of the staff today in the country, will be autonomous and will be able to invest, will be able to operate, will be able to recruit who they want, will be able to basically contract with private actors, have their own procurement policies, etc., which is a very important move, and so that we can have the public sector in competition with the private sector. And that is something which is assumed, and which comes also with a change in the human resource policies, where within the public sector, where you have much more incentives also that's coming for the public actors to stay in the public sector and to work with them. So these are, as I said, is a revolution, and that means that basically we are creating a shock in the demand, where now we have 11 million, actually 22 million people who are going to be insured. And that means that basically we need to work also on the supply side heavily, whether it is in infrastructure, whether it's in human resources. And that's why the strategy here is already to increase the capacities, to increase the trainings, the cohorts, not only the cohorts, but also reduce actually the timing of education, so that we can create much more supply, which is absolutely required. There is also an acknowledgement that the public sector is not going to be able to support all this shock by itself. That's why there are incentives also for the private sector to invest in remote areas, in other areas, a lot of incentives also, on opportunities to do public, private supplies in the public sectors, public-private partnerships. So this, let's say, this reform is actually creating a shock not only in the demand, but creating also a shock in the supply, and that's why it's very important to work on all the areas of the supply of the chain, of the value chain, from basically human resources, the IT system, the infrastructure, etc., etc. There is also obviously a willingness, obviously, to reduce the cost of the system, because you know when you create an insurance system, basically the risk is that basically the cost explodes. So there is a work on also on medicines, on medical supplies, how to reduce the cost of it, and that's why also the push towards self-sufficiency and made in Morocco is quite important in this integrated reform. So today, what we can say about where the reform is going, and which comes also with a change in the governance of the whole system, etc., is that there is clearly a willingness to have better quality in the future, to have more investments, more. That means that assuming that the sector will grow at a higher rate than the GDP, and that means that more funds will go to the system, including from the national budget towards the health payer. With an ambition to reduce the out-of-pocket of the population to 25% rather than 50% today, which is what that means, that we have not only 30% of the population that's going to be insured, but it's 100%, with an out-of-pocket going from 50% to 25%. So it's very challenging. It means that it's quite integrated, that it requires a very thorough governance, and being quite prudent also on the insurance product, so that we don't have an explosion of the costs. But it means also a lot of opportunities for private players, because the public sector is not going to be able to support this shock of demand, and that's why also we have a lot of changes in the regulations, including on who can invest in clinics, who can invest in creation of medicines, etc. And we start showing, some clear successes. You spoke about the pharma sector, but there is also now networks of clinics. We have that. Well, we didn't have that before. So things are evolving in a very rapid way, including on the tech part or on the startup parts, because given the scarcity of resources, everything that can be mutualized or facilitated through technology is going to be encouraged, whether it is in telemedicine, telediagnostic, all these innovations that are here to reduce the scarcity of resources that we have.
Hassan, thank you. I think really interesting on the reflection of the shock of demand and the shock of supply, and I think and the real positive opportunities that may be coming from that for sort of further commercial collaboration. I mean, perhaps to dive into that slightly, what do you see as the main market trends, especially with the emergence of startups, innovative startups on new health solutions? And I suppose a second part of the question, and you've touched on this with the regulatory changes, but why is Morocco an interesting market for foreign investors?
So today, just speaking about startups in Morocco, we are not where we should be, given our GDP in Africa compared to other countries, right? So the level of investment in the startup space are still quite low, compared to Nigeria or Kenya or South Africa or Egypt, for instance, given the size of our GDP. Now, many reasons can explain that. One is obviously we are a much more regulated country, and in terms of fintech, in terms of health supplies, etc. So that's a quite important element. And the second reason is that maybe also before the new development model, the country or the state itself didn't see the interest in the startup ecosystem, etc. Now things are moving in a very rapid way again. obviously facilitated and encouraged by the new development model. But what we can see already is that even within the health sector, the success stories in startups, many of them come from the health sectors. We have Dabadoc, which was one of the first startups that raised significant Series A or seed or Series A investment. We have Moldiag, which is a company during the pandemics which grew a lot, doing PCR tests, etc., which is a very, very interesting success stories. And we have now more and more acceleration programs, including from laboratories or from L'Université Mohammed VI, for instance, focused on health tech. And we know also that the Moroccan health tech system is also is also quite well viewed in the African continent, and we have a lot of exports, actually much more than work in the country from these startups, especially in telemedicines or telediagnostic, because the public sector does not have the ability to contract with them. However, in Djibouti or in Guinea, etc., because of the scarcity of resources, many things are outsourced actually to Morocco through the technology. We have also a lot of startups, especially in medical devices for dentistry, etc., that operate through Morocco, but are actually aiming 95% or 98% of their market is actually abroad, in the US or in Europe, etc., through 3D technologies, etc. So things are evolving in a quick way, and especially regulation is going to increase that with new laws for telemedicines, new laws for to allow also the public sector to contract with startups, and that is going to give a huge boost to the sector, on top of the Mohammed VI fund, which will have a compartment for innovation, which will bring also more funds for this kind of startups. Okay.
Thank you, Hassan. I think you've spoken there about some of the new regulatory changes and a lot of the sort of push towards local demand, local supply, some of the new elements coming in. What's your assessment of what the Moroccan health market might look like in the next 10 years, given those developments?
So there are many trends that are quite important. So obviously there are the demographic trends and the epidemiologic trends in Morocco. We have change of that. The population is basically getting older, and also we have much more transmissible diseases. And we are moving towards more chronic diseases, obviously. So there is a change also in the nature of the market. And I think something which is quite clear is that given also this reform and the ambition also of growth that we have in the new model of development, it's clear that the health sector will be growing at a higher rate than the GDP. And the objective also is to not to grow too much, because that means also a cost, an important cost for the national payer. So the idea here is probably to be like 1 or 2 points per year above the GDP in terms of growth for the sector, which is already very, very important, right? Now, given what we said and given the evolution of the sectors in terms of autonomy of the public sector, ability to contract, etc., the relationship between public and private sector will be much higher, right? And today we have two sectors that almost work in silo. Tomorrow, the idea is to have a much more integrated, flexible system where public, let's say, hospital can buy services from private sectors, where private, let's say, practitioners can operate in the public sector, where we can have public-private partnerships, where we can have startups working for public sector, etc., where we have actually, trainees from the private sector getting their training in the public sector, etc. So this integration will be much higher, and which so that we don't have two different systems, but a much more integrated system. We have already a privatized system. We have more than 50% of the activity today, which is in the private sector. So we are not moving into an NHS kind of model, but we still have both the private and public sector, but operating in a much more coordinated way and in a much more integrated way. The second area I think where we can see is, Morocco, we spoke about Ben Slimane, but is going also and is well positioned to be a hub for the African continent, given that we are above the other countries in terms of transitions, epidemiological transition and let's say and demographic transition. So we are facing some challenges that African countries also might face in the next 10 years, or etc. So we develop and already today we are benchmarks, for instance, in terms of vaccination, in terms of maternal health, in terms of family planning. So we have some let's say opportunities where to grow our markets beyond the national the country, but to move obviously in the continent, in the African continent, but also in some situations, especially for French-speaking countries, for instance, like everything that is linked to telemedicines or telediagnostic, etc. Given also the scarcity of resources in Europe, this is something also that can be developed in a very heavy way in Morocco.
Hassan, thank you. I think, again, a really interesting set of comments there around what the current Moroccan health policy is going to mean for the system in the near future in terms of that shock of demand and shock of supply that you've spoken about, and also really interesting reflections on where the startup environment currently is in Morocco, and again, where those opportunities may be for the UK companies who might want to look at the market, why Morocco is an attractive market, both in terms of the demand that's going to be growing in Morocco, but of course, as we see across a range of sectors, how Morocco places itself really as a gateway to Africa, and the opportunities in the health sector as well to be using Morocco to access the surrounding region. So I think, again, some interesting reflections there for us and for any companies listening about where some of those opportunities may be. Thank you for your comments. Mr. Hassan Ghazal, to turn to you now, thank you very much for joining us today. Perhaps I could ask you to begin, how large is the scale of use of digital health in Morocco at the minute?
Thank you, Chris, for offering me the floor, and thank you for inviting me. This is the third time that I am participating in a Bridgeham conference, and it was always a very important experience, at least from my side. So to respond to your question about how far is the digital health use in Morocco, let's be honest about that. Digital health is in its infancy in Morocco, but it's very promising, and I have been following and observing the evolution of digital health in Morocco for the last maybe 12 years, and I can see that there was always an evolution, yet a steady evolution, but the trend has been accelerated by following the pandemic COVID-19, and I will come back to that later. Now, during this evolution, there was an element of the puzzle have been set up, and that make us very optimistic about the future of digital health and its impact, real impact on health system as a whole. So let's first start, but what we can call sectoral politics. So in Morocco, the main actors are on digital health are the Ministry of Health, of course, then the digital development agency. And if we look at the strategic plan of the Ministry of Health, we can see that e-health have been put there since 2008. And there was a medical informatics division at the Ministry of Health, yet it was a small, with mission, not clear missions as to develop a real and impactful digital health in Morocco. But it has the advantages of being there and citing the term, which is the first main step in towards really towards implementing this digital health policy. Then recently there was a strategic plan, the last strategic plan 2025 with the horizon 2025. This is for the first time that digital health really has been put there in clear words, and it was there was, we can for example cite the Access 23 in this strategy that is talking about establishing a health information system, a national integrated health information system with the main element, which is with the other associated elements, which are the electronic medical records and data centers dedicated to health, and of course the use of digital health in the drug distribution and logistics system to make a rational to allow a rational provision in terms of drugs which the country, because at that time still not that smart system. So this is yet we can see that it's not a real policy. It's fragmented. It's in different action. It's just small actions. It's not a real policy. And one for the second actor, which is the agency, the Digital Development Agency, in its strategic plan 2023, the agency spoke again about digital health in its third axis, and with two main actions. The first one is to establish national electronic medical record, and second one, deployment telemedicine in rural areas. And as of this, talking about this rural area, the main, another third main actor, which is a recent one, the Moroccan Society for Telemedicine, which is different than our association. We are a research association. This is a real kind of national agency, because given the importance of the board members, the society has been mandated by the Ministry of Health to deploy a real national program targeting rural and remote area, with the ambition to cover 160 villages, isolated villages all around the country by 2023. This is a real ambition, very important program. I think one of the biggest one in the continent. Yet it was set in a very I think pragmatic way, with three steps. The first step was a pilot phase, which tackled around six villages. This step was already done, and now it's the second phase, with the ambition to cover another 32 sites, taking advantages of what had been learned from the first experience. And there was a lot of things that has been learned that makes the next steps more successful. And let's give you example. For example, that just an example, that's you have to arrange your system according to the local markets, because during the local markets, the weekly local market, that you have a lot of demand, so you have to take care of that. And we learned also the lesson that you have to think about the cultural thing, because in this area the nurse is also a man, because you need someone that knows a little bit of technology to help the patients to get in touch with the remote medical doctors in the hub in the Casablanca, for instance. And given this cultural stuff, you cannot, in this area, it's not easy for a woman, for example, to speak openly about some intimate burdens. So this is one of the two lessons, and there is another two lesson, that once you find a solution, you need at least to think about the whole system, because it's not that as simple to diagnostic a disease, and and the flow up is complicated, because this area are remote, and you need to think about the whole system in terms of care provision, in terms of emergencies, in terms of drug distribution as a whole. So this is about this. And now of course, because of the pandemic, the second phase has been a little bit delayed, but the ambition is always there. And the fourth main actor is the CNDP, the Commission for Data Protection, which is the GDPR Morocco, and it's one of the main actors actually in the field of digital health. And the CNDP is aware of that and set up a commission which is called Data Health Commission, because at the end of the day, the telemedicine and digital health is about data, and how these data are used smartly but safely and securely. And CNDP is aware of that. The Ministry of Health is aware of that. And the legislation has given the CNDP a lot of power in terms of providing of the authorization to clinics and medical doctors to provide digital health care. And of course, now you cannot before asking the Ministry of Health to provide and its telemedicine commission to provide the authorization, you need first to have the approval of CNDP, and as of a guarantee of you are aware of the confidentiality aspects of data health, and about the system. You need the system to be secure in terms of techniques, but also in terms of good usage of this data. I can mention here the initiative named Data Tika. Data Tika means confidence in Arabic, and it's a general frame, but with health as the main component of it. Then of course I cannot forget one of the main actors, which is the physician order of medical doctors, which actually the national order of physicians, which actually has been aware of, really got the awareness of the importance of digital health and telemedicine following the confinement, because of the next day there was no patient in most of the liberal cabinet. And then not the importance, but actually the must having a digital health system was announced and was expressed. And following that, the order have set up a telemedicine commission. I was part of it, and thanks to this commission, there was a mandate of the Telemedicine Act, because the Telemedicine Act, that is another element of the puzzle that in Morocco we are proud to have this legal frame. We are one of the very few countries in Africa and in the Arab world having this legal frame, which define the contours of Telemedicine Act, following the general medicine practice frame of 2015, which the first time will define what telemedicine as a main element in medical system in Morocco. So this is maybe in few words and finally, let me tell that in Morocco, telemedicine, because telemedicine is what really we are talking today about, And of course, you cannot have a real telemedicine if you don't have the main two elements, which are a health information system and the electronic medical record. And these elements are not yet well established in the health system in Morocco. Yet recently, the Ministry of Health has launched a big offer, a big call for interest to establish a health information system that should be uniformed, at least in the main university hospitals all over the country. And let's see that telemedicine, when we look at telemedicine in Morocco, it was existing since maybe 2000, so for the last 20 years. And we had many pilot, many short-term telemedicine experience. Let's mention teleoncology between Rabat and Brussels. You have telecardiology between the US and Marrakesh. We have tuberculosis, a mobile health tuberculosis with the Korean cooperation to help adherence to the tuberculosis treatment. But the main telemedicine project was the one by the Moroccan Society for Telemedicine targeting health, and the second one was the one of the Marrakesh regions, which really tackled around 28 states in the region. So that's in few words the situation here in Morocco. But the pandemic has accelerated the trend, and things are getting another level now.
Sam, thank you. I think really interesting assessment of where things are at, but some of the strategy and some of the regulations that are in place that really are paving the way for a lot of growth in this particular subsector, as it were. I suppose a sort of two-part follow-up in my mind, which is, and perhaps reflecting on some of the comments that Hassan had made in his presentation as well around how the system's going to be developing. Sort of firstly, how you see e-health perhaps potentially compensating or helping to fill some of the gaps on the need for development of health structures and human resources that we've reflected on. And I suppose specifically within that, do you see a particular role for digital care, robotics, and machine intelligence?
Okay, so actually, let's say that digital health is seen and has been seen as a complement to medicine, and has been seen as medicine where there is medicine when you cannot do physical medicine. Yet with the pandemics, we discovered that telemedicine is for all, in all times, and you need to have a telemedicine component in the medical system, and as a main element. Actually, the trend is that the trend and the promise is that the A of health will disappear in the near future, and we will be talking just about health, and digital will be just another main. I mean, it's like inherent quality or qualification of health as a whole. So I think, but let's see how a health developed. For example, in France, the digital health system has been developed because to solve the issue of medical desert, what they call medical desert, which is these villages that when you have a retired medical doctor is never replaced by young people, because the young generation would prefer to be in metropolitan cities. And in Morocco we had this vision, and that's why this was this big program by the Moroccan Society for Telemedicine and the University Hospital Mohammed VI and University Mohammed VI of Casablanca, targeting mainly the rural area, because we think that they are the need. So and this will solve one of the main of at least the three main problems of the health system in Morocco: equal access to health, quality access to health, and quality and of course the cost. And in terms of equality of access, let's say that we have this problem of we have this issue of that we have all medical doctors in Morocco. Yet I think our colleagues before me just talked about this issue that we need. Morocco miss a lot of medical doctors, The problem is much more complicated because all the available medical doctors are concentrated in the area between Casablanca and between in the big cities, namely between Fas, Tangier, and Casablanca, Marrakesh. Yet only the rest of the country has missing a lot of general practitioners and specialists. So the digital health will solve, for sure, will solve the issue of access to this to health and quality health in this remote area, not only in terms of specialists but also in general practitioner. This is one thing. And the second thing, we have facing a big brain drain. Yes, we know that we need a lot of medical doctors. Many universities are forming medical doctors are in Morocco. Private ones are joining. The system is open to private sectors, and the system also is open to foreign medical doctors, foreign investment. Yet we are facing another big problem, which is brain drain. A lot of our medical doctors, once formed, they prefer to go to Europe because they have better salaries, or maybe better quality of work. And how we can stop this brain drain, or how we can make use, how we can compensate with this brain drain, maybe by using telemedicine and encouraging the diaspora. We actually estimate around 10,000 medical doctors acting only in Europe, and these medical doctors they all love their countries and they all would like to help. And we have seen that during the pandemic, with the establishment of this platform, made help to help our national that have been we have nationals that have been stuck in outside of the country, and this platform managed by our medical doctors in diaspora have been helping our people and the government in setting up. So digital health will sure solve the issue of quality access and the issue of cost. And let me finish with this this experience. This very interesting experience of teleecography targeting pregnant women at risk of pregnancy, that was set up in the region of Fas between 3 villages, I think Ribat al Khair, Walmas, and another village, I don't remember the name, but with these villages have been the target of this teleecography with the University Hospital of Casablanca and the one in Paris as the second opinion, and as actually the program was made by a company named Qualcomm that would like to prove how the system is efficient in terms of access, quality, and cost. And the conclusion, after 575 exams using just 3G to transmit data to this second experts university hospital, we come out with, we could reduce the time to get a second opinion by from 2 weeks to 24 hours. We could reduce the cost from $80 to $2, and we have seen an improvement of quality of care given provided by midwives in this area. And as a consequence, much more of women have been visiting this center, health center, to check their pregnancy. So I think these elements are main proof of the importance of digital health as to compensate some of the main burdens. And I cannot forget to mention that we are a country that is getting older. I mean, and more chronic diseases are coming, and these chronic diseases needs to be followed up, and telemonitoring and using artificial intelligence and maybe robotics will help. And as talking about robot, let's see that in Morocco, to our knowledge, there is no any robot experience in practicing clinics. But of course, we know the quality of our medical doctors, and I am sure that they will rapidly adopt the kind of Da Vinci robot used in robot-assisted surgery. And as about artificial intelligence, we can mention that some medical centers already, in radiology, for example, they already use artificial intelligence and algorithms, intelligence algorithm to help in interpretation of their DECOMs, because this is the shortage of radiologists, and the needs of these experts will absolutely be compensated by this intelligence and telemedicine. And as about artificial intelligence, let's see that Morocco is very aware of that. And I mentioned here the program Al-Khwarizmi that was launched by the IDD, the Development Agency, the Digital Development Agency, and the Ministry of Education and Research, and targeting artificial intelligence, inciting researchers to get involved in this trend. And we were surprised that having 215 projects that comes out in short of time, with 45 have been granted, and out of this 45, almost half have been targeting health.
Hassan, thank you so much. Interesting set of comments again on I think, well, what we're currently seeing as a sort of subsector within health around e-health, but I particularly liked your reflection that we will probably be dropping the E soon, and that e-health will be just the way we're talking about health in the years to come. And I think, again, a very useful reflection of sort of where the market currently is, and where some of those key opportunities are for potential collaboration in this space in future, given the projected growth and usefulness that is coming. Thank you all for your comments. I'm afraid we're very tight on time for the Q&A from the audience, which I certainly didn't want to cut anyone off, as it was a fascinating set of presentations. But perhaps partly by way of conclusion, and partly as a way of trying to summarize a range of the questions we've had, which are all great, and I hope before we launch into the one question we'll have time for, we can invite the audience to reach out to us all directly if they have any specific questions. But perhaps partly by way of conclusion, and partly as a way of addressing some of those questions, that given the focus we have today on trade and investment opportunities between the UK and Morocco, perhaps I could invite each of you to reflect in a minute or two really on the role of private-public partnerships, because I think this seems to be the key space that there may be commercial opportunities for the UK. And perhaps reflect on sort of, what the role is on private-public partnerships in the health space, and what the key elements should be in mind for any company from the UK that wants to look into private-public partnerships in Morocco. Azadine, perhaps we could start with you.
Okay, so it's going to be really quick. I think if you want to invest in Morocco, you want to be trusted and trust the country, and to be confident that you'll get your money back. So that's something very important. I think two things that are really good for Morocco, and everybody should be doing it, and it would be a marketing pitch that we'll be doing. It just, Morocco could be a gateway to Africa for the British companies. I believe in that. I think Morocco has very good connection in French-speaking Africa. I think just for the pharma part of, for example, for the generics, for the pharma part, Morocco has a really very good relation with Ivory Coast, Senegal, all these countries that not French-speaking, English-speaking countries, and Morocco can play a role in that and could be a good gateway. The other thing, Morocco is English and British friendly. You can believe in that. Morocco is really switching toward the English, toward the Anglo-Saxon way of doing things, and I think two things are very important to do. Do not hesitate. I think it's really something that I will have to say. If it's really safe, come to Morocco. In other sector, I will say. I'm just promoting Morocco as a label, not just in the health sector, but the health sector, great opportunities, and I think it will be a waste that will not take advantage of all these companies and the way of doing things in Britain, in Morocco. So welcome to Morocco.
Thank you, Azadine. Hassan Balkayat?
Yeah, just reflecting on what you were saying in terms of public-private partnerships. I think one of the elements of the reform is the merger of all public institutions in each region. So now instead of having one counterpart, we will have 12 counterparts in the public sector. And each one is basically a regional counterpart that is able to take decision for the whole region, including in their procurement, including in the partners that they want to operate with. So it creates much more opportunities in a more flexible way for foreign investors or foreign traders to work with the public sector. And I think that is something which is a massive change, including in the way of how the public sector is making procurement. And we know that for especially pharma companies where prices are benchmarked internationally, you know, we have different ways of doing market access with the public sector in the future here in Morocco. That's for me, you know, just in terms of public-private partnership, much easier than you know, operating a full hospital on behalf of the public sector, given you know the politics that can be behind it, etc. However, in terms of day-to-day operations, it's much easier.
Thank you, Hassan. Hassan Ghazal.
Yeah, actually, let's say that given the intensive digital health in Morocco and a serious lack of human competence and resources, and we have very few training programs in Morocco, yet also the intensity. I think it's one of the field that I would invite partners from UK to contribute in, is to help setting up a real program, training program, I think short or long-term programs in digital health, and to support our medical doctors by training at on-site, off-site, on the field, given I think UK is one of the very advanced countries in digital health, as to my knowledge. And then second, we have been as association approached by many companies that would like to invest in the digital health sector in Morocco. And of course, one of our answers to these companies is that you have two choices. Either the Moroccan market is in its infancy and you cannot make benefit as soon as you get involved in. So you have two options. Either you wait until the market is already mature, then it will be hard for you to get in, or maybe you contribute, you help the actors, national actors, private actors, in maturing the ecosystem and be part of this evolution. So I invite companies, UK companies, to be part of the maturing process of digital health in Morocco.
Thank you all for that answer and for all of your contributions today. I'm afraid we've run out of time to take any other Q&A, but again, I really hope anyone in the audience with other questions that we haven't had a chance to answer will reach out to us through Brit Channel directly. We'd be certainly happy from my side to speak further. I think it's been a fascinating discussion today. I reflected at the beginning in my comments about the trade already between the UK and Morocco, particularly on medical equipment and pharmaceuticals, but I think the comments from our panel today have reflected that there's a very positive trajectory on the health sector in Morocco in terms of strategy, in terms of financing, in terms of where Morocco is placed as a gateway to Africa. We reflected on the opportunities that are coming up due to the shifting demographics and the various strategies, how key sectors are developing, and how Morocco is looking to come forward sort of post-pandemic and sort of reinforce and grow the health sector. So I think a lot of opportunities there for businesses in the UK, I hope, to be looking at Morocco as a very attractive market for commercial opportunities and partnerships. I hope any companies on today will reach out. We'd of course be happy to continue a conversation about any ways we can help facilitate any of those further conversations. And therefore, I'd just like to finish today by saying a huge thank you to all of the panel. It was a really interesting discussion. I've certainly learned a lot. Thank you very much to Brit Cham for hosting the webinar and to all partners who were involved. It's been a great discussion. Ramadan Mubarak to all, and I hope to speak to you soon.
Okay.
Thank you very much.
Thank you very much. Bye now.
Bye.